Hello, Cam followers. Please meet the lovely Dr. Sheilah Robertson. We are seriously honoured to have her here tonight. I heard about this amazing lady many, many years ago. Having the opportunity to get her to come and talk to you is huge. So please sit up, listen, get your questions in. This doesn't happen very often. Now, before I let her introduce herself and tell you all of the things she's done, because it's quite insane, I'm just going to do a little bit of a shout out about our book. Many of you do know that we have a book called Why Don't You Listen? It's an illustrated children's book with of educating the child, but also the parent, on how to identify the signs of pain. Now, it was written because, unfortunately, elective euthanasia of dogs that have significant behavior change, which is aversive to, say, a family setting, is actually quite common. And when you actually look into the reasoning why these dogs are behaving in such a manner, often pain underlays it. So please do go and check out our book. It is available in the shop. It's a mere £8. I want it in every primary school. I want it in all the children's organisations. I want vets to stock it. I want pharmaceutical companies to promote it, because it is not the dog's fault. If they are in pain and a child brushes past, bumps into them, sits on them, we could fully expect around this app. So let's start educating people about how to identify pain. Right, now, come on, Sheilah, tell us all about yourself, because people will be blown away.
Yeah, no, so I was really excited to get the email inviting me, because I actually watched this channel and knew who you are and everything about it. And I know that it was basically about dogs, but that definitely cats get arthritis. So obviously, and you're having a special month devoted to cats. So I think that's phenomenal. And so I currently work and live in the United States, but I graduated from Glasgow University and very, very proud of that. Did my training there and grew up in Scotland. And then I was in mixed animal practice in Warrington for a little while, and then went to Bristol University to be, I thought, a surgeon. But during my rotation through anesthesia, I got completely intrigued by the anesthetist there, because I would ask him a question and he goes, "We don't know how this works. We don't know how animals go to sleep and wake up, and we don't know why injectables work and then an inhalant works." And there was no answers to anything that I asked him. And I thought, oh, maybe I should do anesthesia so I could help answer these questions. And then, of course, then that introduced me to perioperative pain management, and then dealing with animals with chronic pain that come for surgery. So it really broadened my outlook on everything. And I don't think I've answered a lot of the questions yet, but that's a lifelong looking at.
You've been integral to many of the big progressions that we've made in the last couple of decades. We're extremely lucky to have your knowledge, your mind, but your passion about the topic. So you were just saying that you're on we say WSAVA, but you say WSEL, don't you? So the Global Pain Council.
Yep.
So you've been really integral for driving improved pain management practices across the globe. So incredible.
Yeah, that's been something I've been very, very proud of, because we know that a lot of drugs aren't accessible to all veterinarians in all parts of the world. And so, we've developed anesthetic and analgesic protocols that, anyone, like regardless of what access they have to different, drugs, can actually do good pain management in their patient population. So that's been a really good endeavor. And we just published the second updated pain management guidelines, and they just came out last year. Very, very big open access document. Yeah, it's lots of very nice illustrations. It's very practical.
Yeah.
It's excellent, and we're very proud of that. So I spent most of my life out after the UK in academia, like teaching students, doing research. But for the last 6 years, I have been working with a company called Lap of Love. And so it's an in-home euthanasia and palliative care company in the United States. We have close to 300 veterinarians now working for us, and we're all over the United States. And we help about 11,000 families a month with their end of life care, chronic disability, dogs and cats, and then of course the what we like to call the final appointment. So the saying goodbye, we do it in the home. So it's been very, very exciting for me to be in a different niche, but seeing what a difference how we do euthanasia, what a difference it can make to that, probably a lot of people's worst day of their life, to be honest.
Yeah, no, absolutely. But the sheer numbers. So all the CAM followers that watch these routinely, she works with Dr. Mary Gardner. And if you haven't watched the live with her, please do, because it's spectacular. She is larger than life on camera, and that she's even more amazing in person. But she's just got so much passion for this area. And you said that she actually developed that passion to do it to the best of her ability straight out of university. So,
Yep. Yeah, she lost, she was actually a software designer before she became a veterinarian, and she lost one of her dogs and she kept wondering why it couldn't be better, and she had all sorts of questions, and she decided she was going to be a veterinary surgeon, or veterinarian as we call them. And so the thing that a lot of people don't know is that Mary Gardner was my student at University of Florida, where she graduated from, but now she's my boss.
That's hilarious. What goes around comes around, guys. You can't avoid this. So behave yourselves throughout your life, otherwise it will come back and bite you. Yeah. I love it. I love it. So tonight we're going to be carrying on the topic about cat osteoarthritis. I was telling Sheila, a big wish of mine for many, many years has been to recreate CAM for cats, and we have the foundations. Right back in 2015, I bought felinearthritis.co.uk with the intention that I was going to do both. And CAM's been a lot harder than I expected, but it is there. We want to do it. And one of the things that we decided, bear in mind we haven't got the funds at the moment, the time, was we could dedicate a month every year to talking about cat arthritis, because you could argue the problem is worse in our cat population, and it's really not being dealt with appropriately yet. But we'll come to why in a minute. So the intention tonight is we're not going to spend so much time talking about observations and diagnosis, because that was covered previously last week. And what we're going to be doing today is we're going to be starting to think much more about what proactive interventions that we can employ to improve the lives of these cats that are afflicted with osteoarthritis. But for those of people that didn't capture the one that we had last week with, it was Dr. Natalie Dalgray and Hattie, which talking about observational identification. Can we just do a quick recap about how we can pick up on the signs of chronic musculoskeletal pain in cats? For anybody that's watching goes, oh my God, that's just exactly what's happening to Fred, who's sat on the sofa here. Just give us an elevator speech, 5 minutes.
Yeah, so I would say that cats are suffering in silence. And yet we know, when we go back over all the publications and all the research that's been done, that if you take any cat from age 2 to 20 plus, and you radiograph their body, you take an x-ray of their body, up to 90% of them will have something wrong with a joint, either in their spinal column or in their appendages. And so the x-ray evidence of them having a problem is very, very high. And then when we actually take those cats and we do a clinical exam and get a history and everything, almost 50% of them have joint pain, and that joint pain is affecting their mobility, and then that means their enjoyment of life. Because don't forget that cats are unique. They live in a 3-dimensional world, right? They like to be up high, like surveying their kingdom, their domain, and when that is inhibited by pain, so they can't jump up and jump down, then it really affects everything they do. For my cats, if they couldn't hop up on the windowsill and bask in the sun, life wouldn't be much fun. And so we need to think about that. And I love that book that you've put together, because what I found is that I was seeing quite a lot of referrals when I was working at the university, cats that had, were not using their litter box. And so they were being seen as behavioral problems, like they're not using the litter box. And I'm like, well, it could be inappropriate elimination, but what about figuring out access to the litter box? And a lot of those cats that aren't using their litter box is because they can't climb into it because of joint pain. And if you take care of the pain, then what could have been a reason for euthanasia, because they're not using their litter box, is gone, and they're back in using the litter box. Or we adapt the litter box to be low entry, easy access, we treat their pain, everything is good again. And again, cats that become aggressive as they age, and I'm like, well, are they aggressive or are they painful? Because cats will defend themselves, because that's what you do. If you're painful, you don't want anyone to touch you, you hide, you don't want to be groomed, all these things. So these behavioral issues often, a lot of them have an underlying pain problem. And and a lot of people just think cats do their own thing. We don't go for a walk every evening, and because cats are small, people don't really notice a lot of these subtle changes. They're not jumping up. They're not where they used to be. And so that's why it gets missed. And cats tend to have problems on both sides of the body. It's not just one limb, so they're limping. So you often, you miss it. And so it can be quite subtle. Or people say, well, what do you expect? Cat's getting old. Of course he or she's slowing down. And it might not be. It could be that they're actually painful and don't want to make those, those beautiful moves that cats make.
Yeah. It's so difficult, as you say, that misunderstanding of, well, it's old. That's what happens. And overlooking like the coat changes, the thickened nails, where they're not actually using the scratching posts anymore, so they don't sharpen the nails, the dirty paws, the dirty face, as you say, accidents around the house, not being able to sleep in the normal position that they would do, being fractious about being handled. And when you say it out loud, you're like, good God, that's a lot. But for some reason, we still don't seem to pick up on it and prioritize it. And I would definitely say, us veterinarians during these health checks, knowing the prevalence, we need to have more confidence to bring up things like coat changes, nails, not being well kept. Cats are meticulous. We find it a challenge. And I think one of the challenges is in a dog in a consult room, you can flex and extend a joint, you can palpate, and you can show a reaction, because the dog might be reasonably okay, and then you do that and and the owner goes, oh, I saw that. Yeah, I saw that. Cats in a consult room, way different, aren't they?
Yep. Yeah. So that's the issue. That's why I really, really have worked hard to promote that owners take videos of their cat in the home environment, where they're not, they haven't been in a carrier coming to the vet. They're all stressed out. And then, they're just like this little tight ball, and they're not going to show you like how they move in the clinic. So these getting videos is really, really helpful to see what they're doing. And, if there's a sunny windowsill and the cat is sitting on the floor, then that's a red flag. Like, why is it not up on the windowsill enjoying the sun? Why is it sitting on the floor? And it's usually because they can't get up there.
Yeah. And I think, so I've got 2 cats at the moment. I've got 3. One's, I could say that I do CSA payments, Child Support Agency. It's Cat Support Agency. Novelist Bob lives with my parents. But now I have Flea and Worm. Felicity Jane, Duchess of Duckpool, and Wilhelmina Ursula, Lady of Lanston. And you watch them move. They're only 1 year old, and they are so slick. you know, they move like water around the house then.
Yep.
And we are not very good at going, they don't move like that anymore. Could there be a problem? Instead we go, oh, they've just grown up, they're getting older. Yeah. But, you know, that's potentially the first indications of pain, the lack of fluid movement, isn't it?
Yep. And just, you know, I never forget when I was really starting to, you know, realize what a big problem this is. And I had an owner came in for an appointment, and her cat was 15. And she quite seriously said to me, and she thought it, you know, she thought she'd made a big breakthrough. She said, finally, and his name was Felix, you know, just common cat name. She said, finally, you know what, Felix, I've trained him not to jump on the counter when I'm getting his cat food ready for him. And she said, finally, all that, no, you can't come up here is worked. He doesn't come up anymore when I, you know, open the can or the tin. And I'm like, oh.
Yeah. It's
because he can't get up there anymore. Not that finally after 14 years, he's listening to you. And then I had recently another owner who hadn't really noticed all these slow changes, and we treated her cat for osteoarthritis. It was pretty, you know, severe, and we were doing. I said, you know, choose, you know, one thing that you're going to monitor, and I said, you know, getting up on the cat tree, like see if he can get back up on his cat tree after we really take care of his pain. And then I got an email and it said, Dear Dr. Robertson, there's a side effect of the treatment that you've given to him. And I'm like, oh. And she goes, yeah. So now he's knocking plants off the top shelf again. And I'd forgotten what that's like. When he was young, I remember coming home and there was smashed potted plants and dirt all over. And it hasn't happened for years. And now it's happening again. And she goes, I'd forgotten that's what he used to do. And now he's back doing that. Yeah. And she said, so yeah, the treatment has a side effect, but it's really good.
It's a good side effect. It's a positive side effect.
And we just laughed at that one.
Yeah. It's, I don't know the figures off by heart of cats that are on treatment comparative to dogs.
Oh, well, so there's some it's pretty complicated data, but if in the US, we have some very, very big corporate practices, and so they have massive databases with all the entries. And so the data I was explaining, like 90+% of cats have X-ray changes of arthritis, 50% of them actually have clinical pain and mobility issues. And then you look at these massive company databases, and like less than 1% of cats are being seen because of osteoarthritis. So we think that less than 5% of cats that have the disease actually are being treated at the moment.
Wow.
And the whole gap is owner education. Like what does, you know, cats get arthritis too, just like dogs, just like humans. What does it look like? It's not the same as dogs. This is what you see. And then the group at North Carolina that's led by Dr. Duncan LaSalle's, who's a pioneer in osteoarthritis research. And so his group have come up with a 6 questions that you can ask owners. And it's a screening tool. And if they answer no to any of those questions, it's a red flag. And then you can, you know, arrange to do an orthopedic exam or work up and use other tools. But it's a very, very good screening tools. And those 6 questions, you know, it can just be on a mail out to, you know, you have an appointment coming up. Please complete these 6 questions. Email them back. They're so easy. They could do them while they're waiting in the waiting room.
They could be just a little flyer.
Yep. And it's just so simple. And they've proven that those 6 questions will catch most cats.
Yeah. Is it the same as the dog ones? In that there's the dog one.
They're different because it's about jumping up, jumping down, playing with toys. And and so it's and you won't get a lot of false negatives. So it's not going to you're not going to waste your time. So it's a very, very good screening tool to use.
Is that on the painfreecats.org?
I can send it to you.
Yeah,
I
because
can,
I'll put it in the link for people.
Yep, and I'll send you the paper. So they had a very complex like questionnaire, and they went like, everybody's busy. This needs to be good for owners, so they kept on cutting it down, but making sure it was still sensitive and valid, and it is.
Yeah.
It's excellent because there are cats as young as 2 that have this disease.
Yes.
Yep.
Yes.
I mean, it increases with age. More older cats are effective, but it can affect cats as young as 2.
Yeah. Well, that brings me nicely onto a phrase that I found in an article that I don't know how I feel about this. I'm going to throw it at you and see what you think. Cats, unlike most dogs, can tolerate bone and joint problems due to their small size and natural agility. Do you think that's true? I just found it
No,
quite a
it's
bold.
not that they tolerate it, because as far as the pain pathways and everything, they're wired the same as a dog. So
Yeah.
if it hurts a dog, it hurts a cat, it hurts a human. Like it's painful. I think what they might have meant is that, quote, it's not, they don't exhibit limping, or because they have more agility than a dog, it goes unnoticed for longer. It's not
Right.
that they tolerate it. That I think the word tolerate is wrong.
Yeah.
It's just that they can deal with like still getting around until like they're not getting around. And
No.
it's
I
subtle.
am.
But yeah, they're wired the same as.
What?
I mean, it's like the whole, one species doesn't feel pain like another. I mean, how they interpret that, but they're wired the same as us. They're wired,
Yeah.
So
And it's the big phrase is pain is what the patient says it is, and that's what we've got to be hugely receptive of, isn't it?
Yep.
But you'll appreciate this. I'm going to slightly tangent. I went into quite I hate when people say that they mask pain, hide pain. I hate that as well. And I've even become completely intolerant of when people say that they cope with pain. I'm like, cope is almost like quite a positive word. He's coping really well with that. And I'm like, no, can't even use that. So I find it really quite hard to verbally describe what animals will put up with regards to pain, because I don't want people to be misled that it's okay that they can be in pain. Does that make sense? He copes really well with his pain. No.
Yeah, no. So what I say is that they can't tell us because they don't speak our language, right? So they can't self-report. Like even young children can self-report or point to an unhappy face. This is how I feel. So it's our duty as caregivers to understand their language, and they have language. And if we understand the language of pain, it's staring us in the face every day when we see these animals that are hurting. So that's our responsibility as veterinarians and as caregivers, that we need to recognize their language, and they have language. And I think to be honest, like pain may be even worse for animals, because if you think of us, right, we can rationalize that tomorrow might be a better day, or we're trying these treatments and maybe tomorrow is going to be better, or I'm going through this treatment because I want to do something a month from now. Cats and dogs, they live in the here and now. And as far as I'm aware, they don't have a concept of the future. So the here and now is even more important. Now has to be good, because they don't know that their owner has just started a new treatment, or that injection they got is meant to help. They don't know that. And they're not going rationalizing, okay, I got treated today and things will be better tomorrow. No, it's here and now. And if things aren't good, and so I think that it could be worse for animals, because they don't have that ability to rationalize what tomorrow might be like. They only think about now. How is it now? So the quality of life is all about how a cat feels about its current circumstances. And if it's like, I can't defend myself from this, person coming at me, or the dog in the house, or I can't get away, I can't escape to my safe place, then that brings in stress, anxiety, and stress and anxiety make pain worse. So we get into this vicious cycle of like I got nowhere I can't get away. I can't hide. And so,
Helplessness.
yep.
Yeah, definitely. The there was in the past, people have said to me that they're not very good at showing signs, which I agree with you. They are. We just don't read it. And I used to use a slide which was a little bit controversial in lectures, talking about the comparative of the UK emergency situation, like NHS waiting room, compared to, say, a developing country where there's really not the resources available and what people would live with. And it used to hit home quite a bit, because if you know you've got the facilities to reduce your pain, improve your health, you can go and access it, you're likely to go a lot earlier and for more, milder clinical signs. But if you haven't got that availability, you just have to get on with life. You just have to adapt and modify. So what you'd see in those two different waiting rooms are going to be vastly different. And you could relate animals that they don't know that there's an alternative. What they have to learn to cope with, I hate the word cope, but learn to live with. And that's why they do just get on. They're not going to sit there going, oh, really, really hurt. They do get on and go to the food bowl. They do try and use the litter tray. They do still try and get up the stairs. But we need to pick up on the subtleties of their change in movement, their posture, their behaviour, etc. Moving on from there, because I want to try and ask you some more detailed questions about how can we also help the vet-client relationship identify that there's a problem, i.e. in the consult room. And that we've talked about how you can take videos and you can do the questionnaires. But say the owner got to the consultation, are there things that you can give people tips about to try and reduce stress, fear, anxiety, and enable the vet to potentially see some indicators?
Yeah, so I mean, doing an orthopedic exam on a cat is quite different from doing it on a dog, and the biggest issue is having the cat adapt or relax in the consulting room.
Yeah.
So what we do a lot now is advise cat owners to give or we prescribe it, and so the cats get some gabapentin prior to traveling to decrease the stress of travel. And the other thing that a lot of people overlook is that cats do get car sick. So sometimes they arrive having vomited and drool, and they feel horrible.
Yeah.
And so there's some, we can give medication to help them not be car sick, so they arrive much happier. And neither of those types of none of those medications really are going to interfere with a clinical exam that's looking for pain. Yeah. And the cat should be more relaxed, and not always, but often they are. Now, if it's impossible to do anything with the cat's stuck in its cage, showing you it's hissing at you or whatever, then that's the time to say, let's reschedule. Right? Yeah. Here's the things you're going to do between now and the next appointment. You're going to take videos. You're going to do this. We're going to give you some medication for the next visit, make things a whole lot better. So yeah, and in the exam room, if you're in an all feline practice, that's great, because there aren't barking dogs. So the noise of dogs and the smell of dogs is very stressful for cats. So if you know a cat's arriving and you see dogs and cats, you should get them straight in and into the room that you're going to examine them in. And often you should make sure that there's feline pheromones in there that make them kind of relaxed. Mm-hmm. And have a nice soft blanket on the table. Treat, like a lot of cats will be very motivated with the little churro tubes,
dreamies and stuff,
like little things that you can put out on a little mat, and they'll come out and they're like, oh, I get fed here. So all of these de-stressing techniques are definitely worth it in dogs too, but in cats, to make that visit worthwhile, and you can actually do things with the cat. And probably their attention span is like you can do a quick overall assessment, but simple things like just looking at the cat from above and looking at its shape. So if they have problems with arthritis in their stifles and their hips, then often they have a very muscle wastage in the back end, because they're preferentially using their front end to compensate for the pain in the back. So you get this cat that's like quite chunky at the front, but they're skinny at the back because the muscle, and then you feel the muscles and you're like, oh, so then you could get a big clue that the problem is in their hips or
Yeah.
in their stifle, and you can focus on that, that
Yeah.
type of, yeah.
And even just gentle palpation, I think
Yep.
I definitely, it's a special cat that I'm going to attempt to do an orthopedic exam with, flexion of carpi and elbow and shoulder. You know, it's,
Yep. And the other thing, if they've been in pain for a long time, what happens is they get what we call hyperalgesic.
Yeah.
Their pain threshold is lower than a non-painful cat. So even if you went to just to gently stroke them, some of them will flinch, and you'll see that flinch. And that's because touch is uncomfortable, because their tolerance to touch is decreased.
Yeah.
And then other times, like maybe they're there and they need a routine vaccination, and you go to give them an injection, and they react like, whoa, that's quite a reaction to a small needle. It's real, because to them their pain tolerance and their threshold is altered, because chronic pain rewires the spinal cord to decrease your ability, like you feel pain at a lower threshold than a non-painful person or cat. So when they like appear to overreact, they're not. That's how much pain they can tolerate before they like.
Yeah, it was the lovely Gwen Covey-Crump, who's one of our advisors, was talking about, one of the most common kind of forms of allodynia is sunburn, and can you imagine being completely sunburned, head to toe, and someone wanting to give you a hug and hold you really tightly? You'd be like, no, I don't think so. So,
and that's why these cats with arthritis, like you say, because they can't do those Houdini moves that they do to groom and have that beautiful coat. And then the owners were like, yeah, well, I noticed that, but they won't let me brush them either. They don't like being brushed. Well, that's because brushing isn't comfortable. It hurts. So we need to get, that's another big clue, right? I mean, right there.
Definitely. So we've all now got a suspicion that the cat in our care, be it 2 years old, be it 12 years old, is showing us indications of pain. A big fear, a big problem, a big expense over here is diagnostic imaging. And I definitely say, in my experience, I get more dogs to the X-ray table than I do cats. Do you think it's a deal breaker to not do imaging?
No. So for me, you can make a very, very good presumptive diagnosis of joint pain, or, by the, asking the right questions, those 6 questions that you ask the owner, maybe some home videos, and then your clinical exam. You can be pretty sure that this is what we're dealing with. And then if you do a treatment trial, then you can confirm that you are right. Because if you treat with the right drugs or the right regimen, then things are going to improve. So that's almost like proving that it's pain because they respond to analgesics.
Yeah.
So I don't think all cats that are being worked up for arthritis need to have all their joints radiographed. Right. And the other thing that we know is that if we take that data that we know is like you x-ray a cat and you see all these changes in the joints, well, what you'll find is that you'll say, okay, that looks like a really gnarly joint. And you go to the cat and go, oh, which one is that? Oh, it's the right elbow. And you're like, wow, it looks horrible on the x-ray, but I'm not getting much of a reaction. And then you go to a joint that doesn't look that bad on the x-ray, and you go to flex or extend it, and the cat does not like that. So what you see on the radiographs doesn't always match up with what you clinically find either.
Yeah, definitely. I think writing off x-rays, if you can do it, don't. I've got an anecdotal N=1 story of my own cat, Derek, and he ended up having a femoral head osteotomy. He had a head and neck excision because he had such bad arthritis of the hip, and he was so lame, and it was clear he was very lame on this leg, and it was severe radiographic findings, and we were like, this could be a salvage surgery. And after that operation, he did very, very well. So I think if you are able, your cat will, you know, tolerate it well. If you have the facilities to have it done, you know, just because we've said you don't need to, you know.
No, it's always nice for a complete database, but I don't think it, you know, if an owner is financially challenged, or you don't have the facilities, or you and the owner don't want to do the risk of heavy sedation, which you would need to do, or even anesthesia, then you can have a discussion and go, well, this would be ideal, but we don't have to do it. We can do, you know, this. I mean, and there are some specific, like, you know, some of the Scottish folds and things that where you need, you know, they're unique, and you might, like, again, be looking for a salvage surgery to help the cat. So you want to know, like, what can we, you know, what could we do?
Yeah. Tell them about Scottish folds, because I think it's still not well known, sadly.
Oh, yeah. Yeah, it's sad. They have a lot of it's genetic, a lot of really severe orthopedic malformations and pain. So it's yeah, and some
I think
of
people forget that aesthetics,
the designer breeds
can have knock-on effects elsewhere, and people don't realize cartilage of the ears, there's cartilage in the joints. If you're genetically influencing this, you're going to genetically influence that. And you know, cats are like 6 months old can have really severe arthritic changes. 6 months old.
Yeah, it can be they can be, yeah. I mean, they're, and of course they're inbred, so that, you know, it's not necessarily getting better, it's getting worse. And because of how they look, they're, you know, it's like, as in America and the UK, the brachycephalic dogs are becoming so popular, like the French bulldogs and everything, with all their airway problems and their orthopedic problems, because of how they look, not their health. Right?
Yeah, exactly.
Not their health. So.
And I heard the Scottish fold was taking a little bit of an increase in popularity again because celebrities on Instagram, which is really heartbreaking.
Yeah, very sad.
However, we will move on. I've got on my list A, B, C, D, F, a number of scenarios that we were going to talk through, but I'm going to jump to a question first because I think it's a good one. Related to imaging, does it make a difference in treatment where the arthritis actually is? Do we treat specific joints with specific drugs, or just generally? That's a really good question.
That's a really good question. So, so if it was isolated to one joint, and like your cat, there are cats that have hip dysplasia. There's cats that have just, you know, one joint that's falling apart. So that would be important. And usually clinically, you can like home into that, like that's going to be the problem. But arthritis in cats they tend to have multiple joints affected, and often bilaterally. So both elbows, both hips, you know, neck, spine, lumbosacral, where the tail and the spine, you know, join. So, so the drugs that we tend to use, and there's two probably major pharmaceutical drugs that we use. So one is non-steroidal anti-inflammatories, which is the first line therapy for humans, dogs, cat, everything, horses that have arthritis. And then we have the much newer monoclonal antibodies therapy against a very, very specific thing called nerve growth factor. And so that's available for cats in the US and the UK. The drug is called Solensia. And so that isn't targeting a specific joint. It'll take care of the pain in any joint that has a problem. So that's why we don't necessarily have to get radiographs of all joints at every angle of the joint, because
I think that's a really good point to just try and create a simple picture in people's head, in that I didn't really understand this till the recent years, is that in OA management, you are effectively treating kind of two diseases. You're treating pain and the nervous system and the adaptations that have taken place, and the disease. And I think people just in their head see the anti-inflammatory just going via the bloodstream and it's going to sit around the joint, just the problematic joint. Well, actually, no, it's really working on our nervous system, which is transmitting the pain, which is, you know, remodeling itself. The more pain that is being transmitted, the more attuned it is to transmitting pain.
Yeah, so the goal is to try and shut down the pain signaling coming from the diseased joint.
Yeah.
Because if that's coming, from the joint into the central nervous system and bombarding it over and over, that's when you get the nervous system becomes a pain generator itself, because it's become altered. And so, yeah, you're trying to shut down the pain signaling from the periphery where the pain started. Yeah, and the other thing is we have to understand that really we're treating pain because that's what makes them feel better. Because osteoarthritis itself is not curable, it's manageable, but the only thing that can cure a joint would be a joint replacement. So we can't cure arthritis at the moment, but we can make the cats very, very comfortable.
Yeah. Over there in America, would you say that more targeted approaches are quite common? And targeted could be surgical intervention, like removing the femoral head in my cat Derek, or maybe doing an arthrodesis, or whatever that might be. Intra-articulars, I do a reasonable amount with dogs, but I'm really not given the opportunity to do cats. And I'm a little bit in fear because the joint's going to be harder to get into. It's going to be much harder to actually joint tap them. But I haven't really found owners have been hugely open to the idea. What's it like over in the US?
I would say exactly the same. Like, cats usually have multiple joints affected, and doing intra-articular treatment is a lot harder in a cat. I would probably want a cat under complete general anesthesia, not just sedated for that. It's a lot more technically challenging in cats
definitely.
to do anything like targeted intra-articular, and you would have to probably do multiple joints. And I would say the number of cats that I've seen over the years that, wow, we have a surgical solution to your problem. That's when you do, that's great for that cat, but that's not common.
No, absolutely. Not sure what this one does. Ear tipping cause issues regarding arthritis? Ear tipping, I assume, is just cutting the ear tip for.
So this is for community. Well, we call them community cats, feral cats,
right?
Free roaming cats. So I do a lot of shelter medicine, shelter work, and I actually volunteer at a very, very large community cat clinic here in where I'm living. And so the universal sign that a cat has been altered, like spayed or castrated, is that we tip their ear. They get their ear tipped, so that if they get trapped again, they don't go through an unnecessary surgery. As far as we know, when they're anesthetized in the trap for their castration or their spay, they get their ear tipped at the same time. So there's good analgesics on board, and they're anesthetized when it happens. And no, that should not influence or have any adverse side effect as far as leading to arthritis. No.
Perfect. So this question will lead us into some of the scenarios that we've got for the last 15 minutes. This is such a good question because the paper, that study that came out that blew everyone's marbles, the world needs to know about it. So are you happy to talk about the study with the chronic renal failure cats that were?
Yeah. So, I mean, there's a lot of studies, and I've actually just finished writing an article as part of a guidelines document about non-steroidal long-term or chronic use in cats. So I think probably the one paper that made everybody think, look up and listen was Dr. Duncan LaSalle's group at North Carolina. They were recruiting a lot of cats for osteoarthritis studies. And obviously when you're recruiting for a drug trial, they get lots of blood work done, they get worked up and everything. And they went back and looked at the cats that were diagnosed with osteoarthritis and all of their blood work. And 68.8% of the cats that entered the drug trials or were recruited because they had OA had signs of blood work that indicated they were starting to have chronic kidney disease, if not already had it. So chronic kidney disease can be staged. We have stage 1, 2, 3, and then 4. And so there's a staging system. And so the issue with long-term non-steroidals in cats is there's a fear that non-steroidals aren't good for the kidneys. Now, what we do know, if a cat has well-controlled kidney disease and they stay hydrated, then non-steroidals can be used. Where they run into a problem is if they are dehydrated or they're going under anesthesia where their blood pressure drops, then they can't control the blood flow to their kidneys very well in the presence of non-steroidals. It inhibits things being released from the kidneys that, organize or I guess are related to blood flow and filtration. So if they're stable in their chronic kidney disease and they stay hydrated, then they can be treated with non-steroidals. And there's several papers, and they're the ones that people refer to are all from Australia, which was one of the first countries that had long-term approval for meloxicam, which is feline, non-steroidal. And what they found was that giving non-steroidals to cats with chronic kidney disease did not accelerate the disease process. In fact, some of them seemed to plateau and do well because probably they felt better, they were drinking, doing other things. So that those retrospective studies kind of allayed a lot of the fear, but they weren't randomized clinical, the way that studies are usually done. So the vets in those studies, they were choosing the cats that looked stable, who was going to get the non-steroidals, and it didn't seem to be a problem. And now there's a prospective study. So they took cats with chronic kidney disease and treated them with non-steroidals and monitored them all sorts of different things over 6 months. And what they did find is that there was a change in one thing, which is proteinuria, which is a prognostic indicator, like protein in their urine, which is a prognostic indicator of their kidney disease. And that did increase with low dose non-steroidal treatment, but nothing else changed. Like no other marker of kidney.
We're talking long term. We're not talking about after a week, months.
Yeah, it was 6 months they did it. Yeah. And they did a lot of things. So we're not quite sure what that means. We don't know what that means. But this is where, if there's severe chronic kidney disease, then we have the other treatment, which is the monoclonal antibody against nerve growth factor, the Solensia. Yeah. And I've been treating a lot of cats with pretty advanced kidney disease with that product, with good success.
Yes.
So we do have alternatives now to non-steroidals. So we have solutions to these problems.
Which is great. And I do have sometimes a little bit of frustration that we become inhibited in our decision making because of the disease rather than the animal. And I'm going to explain this quickly. So I used to work in a practice that had a heart specialist, and quite often the animals in the care would be geriatric and they'd be on heart medication, blah, blah, blah. But these dogs were also painful. But the heart disease, because it was life-threatening, would be like prioritized, and there would be a fear of adding anything else into that therapeutic plan. But actually, when you think about it, if they were comfortable, their stress hormones would be less, actually could have had benefits with the heart disease management. But there's that fear of managing comorbidities. And I just want to remind people, it's the pet that's living with it, and it's our duty of care to look at that seesaw of pros and cons and have a discussion about it. A cat with kidney disease that's in severe pain is going to go, I'm in pain. I need some help here. Yep. So I just think, challenge yourself, speak to your veterinarian. We cannot leave animals in pain. There's got to be another way.
Yeah, I think there was enough in those papers from Australia to show that cats with chronic kidney disease and arthritis, when they're given pain relief, they actually improve. Like even their kidney disease is not accelerated. They weren't dying sooner, but their quality of life was much, much better. And we've got to think about quality of life, not just getting quantity of life, because, you know, who wants to, you know, feel bad because you have kidney disease and painful, right?
Yeah, exactly.
But I think when you treat pain, you know, they start getting more active. They go to their water, you know, any cat that's on a non-steroidal needs to stay hydrated. So we always, you know, long-term use of that drug class, we go like, do you have drinking fountains in your house? Does your cat like to drink out of the tap? Does it like to drink out of a tumbler, you know, a glass? So leave it, you know, like my cats, you know, we have to fill up a you know, like one of these glasses and leave it on the bathroom, you know, like by the side of the sink, because that's where they like to drink from. So it's the cat glass, not our glass.
Nice.
And so, and you see, and every morning I have to, you know, they've drunk, and then fountains, and then to have them in multiple places around the house. So if they're like, they want to get a, you know, a drink, but they're like, oh, you know, there's only one place to get water in this house of mine, and I don't want to go there. So they'll just skip it. So you got to make it in all of the different territories. And if you have a multi-cat household, you got to make sure that each of the cat, you know, each of them has a specific domain in the house. They all have a drinking source, right? So you make it easy for them, you know. And the other thing is you feed them wet food that gets more into them. And then there's other things that you can do to encourage them to stay hydrated, because if they stay hydrated, the risks of adverse effects from the non-steroidals is much, much lower.
Yeah, absolutely. So just because we're running out of time, I'm going to do some quick fire kind of things, because there's some stones that we have not left unturned. So we've got Silencia and we've got meloxicam, which are our licensed long-term first-line approaches.
And robenacoxib.
And robenacoxib.
Yep.
Is that in the UK as well, long-term?
Yep. Well, we don't have any non-steroidal approved for long-term use in cats. So when we use it, it's against the regulatory,
guidance
recommendation. So we're doing it off-label in America, but in New Zealand and Australia and many parts of Europe, you have 2 drugs to choose from in the non-steroidal class.
Amazing.
But again, a lot fewer than you do in dogs, right?
Dogs
have a whole shelf of things to choose from. Cats have 2 things on the shelf.
Yeah, and I was thinking about this the other day. When I qualified 20 years ago, we had meloxicam and carprofen. You know, that was pretty much it. And look at the developments that we've had. It's incredible. But once, say somebody has used meloxicam, hasn't, you know, got what they wanted out of it, and they've gone on Silencia and still not seeing, can you give them confidence that there are other adjunct medications that we can look into?
Yeah, so there's always diet. So we do have some good scientific evidence that specific joint diets can actually be beneficial for cats with OA, and one study was done by Dr. Duncan Lascelles, and the diet that was rich in green-lipped mussel and also with chondroitin sulfate and other joint supplements, those cats were more active. I mean, there was like certain things that they looked at and they were better on that. Fish oil, because of the way that it works with joints. So high quality fish oil at the correct dose, different in dogs and cats, can be beneficial. And then a lot of people forget that you can do physical therapy with cats, right? And so that, because a lot of times what's really happened when the cat is becoming painful and withdraws from the family, doesn't want to interact, the human animal bond is broken, right? The cat's not sitting on your lap. It doesn't, you know, it's just, there's not that bond anymore. So getting the pain under control and then having the owner be part of the treatment team. So things like food puzzles, right? Making them work for food puzzles, massaging them, doing, you know, flexing and bending joints when it's tolerable. All these things can improve their mood, right? I mean, who doesn't like a massage, right?
Yeah. And as you say, if you get up and move, how many people wake up in the morning and go, oh God,
Yeah.
As soon as you get up and moving, you're like, actually, I'm beginning to feel better. So incentivizing them, that's a great one.
And the other things that, it just, you start unraveling the whole puzzle. So when you're not active, and when I say when you or a cat or a dog is not active, they get constipated, and that's not any fun, right? So keeping them hydrated and active, that takes care of that. But if they're not hydrated and they're not active, then we get another problem, right? Constipation. And then that leads to, it's all this
effect, isn't it? It really, really is.
And a lot of it's not rocket science, right? The other thing is, like, they love to be in their windowsill enjoying life. So while we get their medications on board, and we're not going to get them back to being a kitten. So have a ramp, build a ramp, or put a step stool so they can get to the places they want to be. Make sure they have a safe place to go when everything going on in that house is too much, right? I need a nap, and I need a nap away from everybody, right? So make sure that their safe place is available. So we have actual joint diets, or we have food supplement or joint supplements like the fish oils. We have massage.
And you have this. We don't have this over here. Adequan.
Oh, Adequan. So you might have something similar. Like in Canada, they have Cartrophen.
Yeah.
So that's very similar to Adequan. So Adequan is actually approved by the FDA. So it's more considered a drug, and it went through an approval process, which means there's science, actual good science behind it. So in America, it's approved for use in dogs for osteoarthritis, but I use it a lot in cats off label, and it can go subcutaneously, which makes it easier in cats. And so we often do a trial of that. And some cats will respond. We say, what are we going to monitor? And it'd be like getting up on the cat tree or interacting with another cat, or we monitor something. And so usually we do a trial for a month. So that's 8 injections. It's twice a week for 4 weeks, but it goes under the skin. So it's not a painful muscle injection. And we do sometimes see a response in cats. Yeah. So that's
cool. What about, just briefly, because it's an area that we can't really go into great detail, but I want owners to feel there's hope. There's more things in the toolbox. There's things we can do. So other chronic pain, like categorized chronic pain meds. So we've got our gabapentins, the pregabalins, the amantadines, mevantines. So yes, off license. Don't stay at home thinking my cat's in pain. I'm on a first line. There ain't anything else. Please do go and speak to your veterinarian. My lovely cat was on Symmetril, which is amantadine liquid, for a long time, and so that was an addition to the meloxicam and the house changes and the weight control and trying to get the cat up and active as well. So there was many things. And the other thing that, because I can see the time's running short, is don't fall into the trap of my cat only has one problem. I think this is something that we see a lot in first opinion practices. They might be being seen because of hypothyroidism, they might be being seen for chronic renal failure, dental disease, and focus only on that. And you're like, no, something else going on. And I'm regularly having cats that we maybe done a dental, or we've done an ear related procedure. I'm like, just going to extend this meloxicam for say 4 weeks, and let's see what else happens with your cats. And quite often they'll come back and they'll be like, wow, I just thought he was getting old. So that's another thing to consider.
Yeah, that's where cats are really unique. I mean, I have a feeling that cats actually collect comorbidities as if it was a badge of honor, right? Like I always imagine them sitting, in the waiting room talking to each other, like, how many comorbidities do you have? I have 5, It's like, the other one, cat's like, well, I only have 2 so far, but I'm sure to collect a few more, because they do seem to have a lot more. And the thing is that they're all individual problems, but everything is interacting. Right? It's all interacting. And so you need to have a more holistic outlook of the actual everything about that cat, not just focusing on one problem.
Definitely.
They all have to be juggled. And sometimes, they can be juggled without, because the other thing that's really important in cats is the pill burden. So we could have a plan for all these problems, but it involves 4 different medications, some of them twice a day, sometimes 3 times a day. You can't do that with a lot of cats and with the way, people. So we need to, what's most important, what's easiest to get in, like, is there a long acting injectable instead of daily like just working with the owner to come up with a better holistic plan. I mean, I say holistic, I mean just everything plan.
I love that. I love that. I think we need to steal back the word holistic. We need it back, because the real true meaning is treat the whole,
Yeah. And that's the GP, the general practitioner, is the one that has that overall view. They're not like if the cat is referred to a cardiologist, they just see the heart. They don't see the other. So the GP is the one that actually puts all the pieces together and orchestrates the treatment plan for that cat with the owner. Like what is the owner able to do with this cat? What can I do? And they're part of, the owner is integral to the treatment team.
This is a really good question. Can any of the meds be compounded so it can be rubbed into the ear? I don't know of.
Don't get me on my soapbox.
Go for it.
Yeah. So in the US, compounding is like you can get anything compounded, right? You can say, because the owner will say, I can't give this tablet. I'm going to get it compounded into a transdermal gel. And so compounding pharmacies do not have to prove that the transdermal formulation of the drug you asked for is efficacious. All they have to do is say the drug at the concentration your veterinarian ordered is in this gel. But they do not, by law, have to prove that when you rub it on the gel, that it actually enters the cat and does what it's supposed to do. So there are a lot of drugs that can be compounded, but they're of no value to the cat because they don't cross. But there are some that do. I mean, there are appetite stimulants that we use that are proven, and they went through a lot of clinical trials, and they do work transdermally. But it all depends on the size of the molecule. Cat skin is really different from human skin. And so there's big differences. So we do have some good scientific data on the drugs that can penetrate the skin, but just because it can be compounded into a gel does not mean to say that it works.
Amazing.
I did a study with cats looking at an opioid for transdermal gel use. And we had one cat that it looked like it really worked, and they were acting like it worked, and no other cat did. And then we figured out like the cat got it from its ear and was licking it. And that's how it got into the cat, not through the ear, but from it got the gel off the ear, licking it. And so
that's such a good question, because I don't know. It's just not, I don't think it's happening over here. We've got obviously
you have the cascade that should be followed, but here in America you can ask a compounding pharmacy, and they have to prove that yes, the drug is in here at the concentration that your veterinarian ordered, but they don't have to prove that it works, that it enters the bloodstream through the ear or wherever you rub it.
I wonder if that will be something that will trend over here, because we've now got methimazole. That's
the appetite stimulant, and that one's gone through lots of that's solid science. That one is fantastic, and owners are just so relieved when you tell them this medication is going on the ear, not especially when they don't have a good appetite.
No, absolutely. But it is true, cats are quite difficult to medicate. And one of the questions, and I think that's where we'll leave it, this is the last question I'm going to pose to you, because we're an hour and 4 minutes. A lot of owners are scared of going to their veterinarian because they're worried whatever the vet that's going to suggest, they're not going to be able to do. Be it tablet, be it liquid, be it handling, be it even popping it in a box on a regular basis. For any owners out there that go, Mr. Grumpy is a cat that you're not going to be able to do anything with, he's just going to have to accept what he has. what could you say that would just make people go, oh, okay? Because I know, like, Silencia's once a month, and the impact that they'll see, I just beg them to give it a chance, because Mr. Grumpy might become Mr. Nice, and then he'll be easy to handle.
Yeah. No, I mean, I think that's where a lot of veterinarians actually don't actually help the owner. Like, they have a plan, and it's all very medical. Like, I'm going to treat this, this, and this, and it's going to take all of these drugs.
Mm-hmm.
And they're not thinking like how difficult, with everyone's lifestyle and the cat not being easy to medicate, how difficult it is to execute the plan, right? So compliance. So if the drugs don't go into the cat, then they're not going to be helped. And I have a cat that cannot be medicated. I mean, it's no way. So we have to accept that medicating cats at home is a real challenge. And there was a recent publication in one of the feline journals actually surveying like several thousand owners throughout the world about success of oral medication. And it's very, very low. So treatment failure, because you can't get it in. So that's why when I consult with drug companies and they're saying, well, we want to talk to you about a medication for cats. And I go, okay, before we even go down that road, the first thing is it has to be tasty or palatable, or injectable and easy to inject, or last a long time. Because the best drug in the world, if it doesn't get in,
ain't gonna work.
It ain't going to work. So we need to think about administering, or the I guess the vehicle of delivery in cats needs to be different, because they're so difficult to pill or medicate or whatever. So that's why these questions about the rubbing in the ear, yes, lots of companies are looking at technology that will transport drugs, and we have a couple of new ones, that are like spot on medications that are analgesics. I mean, they're listening to cat owners, like trying to get over those barriers of that everybody knows about.
Yeah. Will it happen in our lifetimes? I'm sure it will. The progression that we've got.
I think so. I mean, as you look at how many cats are in households, and and most cat households have more than one cat. So I think definitely drug companies are listening to cat owners and know that cats need help.
They do. They definitely do.
And that cat owners are willing to pay for that help.
Yes. So definitely a take home for anybody that's listening is you do need to speak to your vet.
Yep.
And something that comes up again and again on CAM is owners and the vet relationship. Owners don't ask, vets don't know that you need or want or thought about. So have the confidence to go to your vet and say, this is what I'm seeing, and this is the pathways that I'd like to us to explore. So please be confident to start working with your veterinarian for your cat's sake.
Yeah, no, I think you should go to a cat appointment with your cat the same way as you might, I think you would get a lot more out of your GP appointments if you thought about, what do I want to discuss at this, very short appointment that I have. So you write it down. Like, these are the questions I'm going to ask my doctor. These are the questions I'm going to ask my veterinarian about my cat. And you just, you go through the questions. And they may say, oh, we have a leaflet all about that. And so, boom, you got your answer. But you need to ask, do your homework and write them down and get those addressed at your valuable visit.
Yeah, exactly.
Yeah, and often a lot of practices have fantastic nurses that can spend more time with you, right? And
absolutely.
So they can help with the owner questions and literature and where good websites to go visit about X, Y, or Z.
Yeah. We're hosting, we've got some nurse courses. I'm just going to do a blatant plug. So CAM's got courses for nurses, canine professionals, veterinarians, owners. We have covered all bases. So if you fall into any of those categories and you're looking for extra learning, some of them are RACE approved. So if you're looking for CPD requirements, I'll put a link to our education centre. but we're hopefully going to be working with a big chain of vets here in the UK, training up their nurses to do utterly ultimate OA clinics. So that's really exciting.
I mean, I think nurses are more than capable of, like, you know, doing a lot of the interaction, you know, with the owners, and showing them how to do things, like how do you correctly pill a cat, how do you massage a cat, how do you do this, that. I mean, yeah, utilize good nursing staff.
Definitely.
Really is essential.
Definitely. Sheila, you're lovely. And whenever, like, all the cam followers can listen to this.
So are you. Yeah.
It's quite intimidating from my part because, you know, Sheila, the letters after her name, all the things that she's done. And there's always a moment when we meet just before we go live. I try and have half an hour with a guest and we try and chat. And there's always a little bit of fear in me. What happens if I don't get on with them? You know, if they're quite hard to speak to. It's not actually happened, which is amazing because we've done 400, 500 of these lives now. But you are adorable.
Well, thank you. Well, I mean, it's like I mean, my job now, because I mean, I've been a veterinarian. Can I say it? 42 years, coming on 43 years. I graduated as a teenager at Glasgow, and you know, I just want to pay it forward. I mean, I've had a wonderful career. It's not over at all. But yeah, I want to pay it forward and you know, share. You know, I've learned from my mistakes, and so I love to teach, and you know, we can all
good at it.
We can all make a difference, just a little bit here and there. And cats are, you know, I often start out a CE lecture. I say, so who here is owned by a cat? People go, what? So because they're expecting me to ask, who here owns a cat? Because we're talking about cats. I always say, who here is owned by a cat?
No, I'm owned by two, very much.
Yep. Same. Well, I have. Yep. I have people might have seen one.
Yes.
Visited.
Yeah, visited. Definitely.
That was Oliver. Yeah, that was Oliver, one of the youngsters. Yeah.
I love it. We did one live and Flea came from nowhere and attacked my back. But no, thank you so much.
Well, thank you so much for inviting me. It was awesome. Thank you. Anything I can do?
Well, I'd love you to share that screening tool so I can put it out there for the followers.
I will get that to you.
And that'd be great. And then we're going to invite you back because getting your knowledge out there is just such a godsend for the people that listen to us. So thank you. So I'm going to say good night, guys. It was really great hosting tonight. We've got so much more happening this month. It's a really
I know. I saw you're kind of busy. Yeah,
it's a busy month.
Great. That's good.
Please do tune in. Tell your vet practices, tell your canine professionals, tell your friends, your nurses, your therapists. It is Feline Month. This is the month where we really do start making an impact on OA chronic pain management in cats. Thanks a lot, guys, and we'll see you later.
Bye. Bye, everyone.